Dr. Wall, you brought in data, which is somehow, in my personal opinion, I feel like it's the cyclical nature of data. You need more data to be able to substantiate that either this digital health tool or this technology or this mode of care is required for the betterment of maternal health and for ensuring health equity. But also, to be able to get more data in, we need to make sure that the consumer, in this case, that is the mothers, are able to use that technology. And it's the cyclical nature of data, which I think sometimes things may get lost in that. But I would love to hear more from um, um, Dr. Jerry Molnar from Cerner, who's also here in person, if he could just give a couple of comments on what he looks at, how he
Well,
looks.
I think, to dovetail off of what Jeff was talking about, the ability to engage the patients more with regards to their care delivery, I think is critical. We know that the more involved they are with their care and giving them the tooling to do that, that's what the portal, as we were talking about earlier, can accomplish quite nicely. So patients are contributing to the record, and also being able to access their record, so they can be more involved, and that's going to translate into better outcomes. Those patients have closer relationships with their care provider, which then allows them to engage them earlier in the course of illness, so that we can respond, earlier in the course of disease. So that I think is really critical. And then there's just given the providers tooling that will enable them to deliver that care in the workspace in an efficient and effective manner.
I just to one last comment along those lines would be that what we have and what we're currently collecting in most EMRs is very, very much the clinical data, and we are frequently missing a lot of the other things that are really important to the patient and that affect that patient's lives and can ultimately impact their care. But we're still very much focused on collecting the blood pressures, the proteins, and the ketones, and and the labor documentation and all that. And we're not as good at collecting the personal stuff that helps us know the complete patient. And that's where I think, and that I think is really what helps drive the conversations around health equity. It's not just knowing the clinical data, but also knowing the patient.
Yeah,
Uh,
and that's the next turn of the crank, if you will, in regards to where we're going along the social determinants and being able to use the technology to not only look at a population of patients, but then be able to look within a community and then at the person level, as well as where we're heading with our social determinants of health, so that the caregiver has a more fuller picture as to what that patient's circumstances are, because those are important things that impact how effective we're going to be at helping them with their problems. And it could be just as simple as making arrangements for travel to and from the office, for example, and getting them hooked up with other uh, organizations that can help them with if they're in food deserts, for example, to get them good nutritional foods, for example. So all that is we're moving along that path to get rid of some of those disparities that as communities we can address, because there are lots of organizations that are already doing that, but having an enabling technology to better coordinate that is, I think, going to translate into better health of the community.
So an
Veronica?
already really, can you hear me?
Yes,
Okay,
absolutely.
great. Thank you for having me. And already I'm really enjoying the conversation. So even, being here as a sort of panelist, it's great to be able to hear from like-minded folks. So I'm Veronica Adamson. I lead Philips vital sign monitoring business in the lower acuity space. And I'm also Philips maternal health champion, and co-founded an organization called North American Moms at Risk. So very focused on how we can improve maternal health outcomes, and frequently sort of on the same discussions with Dr. Lawson here. So glad to be here.
Jessica?
Thanks so much. Great to meet you, Veronica. The question I had following up with what was brought up in terms of data was whether Cerners and Epics of the world that are having access to all this data, is there anything happening in terms of CDC's SVI index and how that is used? Because there's so much talk on SDOH, and I feel like this has been going on for so many years now. But where is it coming? I'm always curious to know if the big platforms are able to embed that and then help practitioners and providers actually customize the treatment and have better knowledge of all these social factors. So that's just an open-ended question, but just curious on the SDC SVI index, the social vulnerability index, and how it's being used in EMRs, or is it at all? Thanks.
Oh, well, we're actually working with a third-party vendor that actually leverages that in part of the data modeling that they use to locate those vulnerable groups. So that is, and we're partnering with Javion to accomplish that. So yeah, so there's definitely we're leveraging information like that to help us better understand the populations.
Wow, that's really great to hear. Thank you.